Hi, my name's Andel, and I'm a first year nursing student. I'm here with my patient Jim, who is an 82-year-old male patient who has had an established trach for about 10 years, and we're here to do trach suctioning on him today. Prior to coming into the room, I would have checked the doctor's orders and made sure that there was an order for this procedure to be done today. And I would also check my patient's baseline vitals and any allergies or medications that my patient's currently on. Upon coming into the room, I would perform hand hygiene and introduce myself. Hi, Jim. I'm Indel. I'm here to do trach suctioning today. Are you okay with that? Can you give me a head nod? All right, great. I'm going to go ahead and check your wristband here just to verify your name and date of birth. Okay, we did that. And I'm going to get a set of vitals on you really quickly, okay? Okay, got a set of vitals. At this point, my patient is on 2 liters of oxygen. So I would go ahead and hyperoxygenate him up to 10 liters. I do have Kelsey here with me. She's gonna help out with the oxygen just to make sure that we don't lose it in the process, okay? At this point, I would also leave his pulse ox on so we can monitor his how he's handling the procedure throughout. Here I have my saline, which is a brand new bottle. I have my suctioning equipment, and I also have my sterile gloves. At this point, I have pre-opened my sterile saline. Okay, so I'm gonna open that up. I'm gonna open up my suctioning equipment. I'm gonna take that out. My left hand is going to remain my sterile hand at this point. I'm going to put a little bit of saline into my container here. Put that cap back on. I'm going to turn on the suctioning equipment to regular and turn it up to about 95. Anywhere in between 80 and 100 is okay. And I'm going to hook my suctioning tube up to the suctioning. And I'm going to verify that this is working correctly. We are working. Okay, at this point, my patient is hyperoxygenated, so I'm going to go ahead and have Kelsey take off the oxygen tubing. Hey, Jim, remember, if you're having any discomfort or anything, go ahead and put your hand up, okay? Okay, Jim started coughing, so we're going to start to pull out. And as we do that, we're going to suction. Go ahead and put the oxygen back on. And we're going to over-oxygenate him, give him time to recover a little bit for about 60 seconds. And then we're going to go ahead and do the procedure again. At this point, I'm going to clean out my tubing here. Okay, now that we're back up to 100%, we'll go ahead and remove that. Set it on the side there. Okay, one more time, Jim. Okay, Jim began coughing a little bit, so we're going to go ahead and pull out the tubing. As we go, we're going to suck. Okay, go ahead and put the vacuum back on. I'm going to clean this out one more time. Okay, at this point, I'm going to turn my suctioning off. Remove this. And discard of this into the wastebasket. Jim, are you breathing a little bit better? Okay, we're just going to let him get his saturation back up. At this point, I'm going to turn his oxygen back down to 2 liters to his baseline and obtain another set of vitals to make sure that he's not in distress at all. I'm going to make sure that my patient's head is lowered to its lowest position, that his head is back to how he is comfortable. Make sure that his call light is within reach. And at this time, I would document the date and time that the procedure was performed. I would document how the patient handled the procedure. I would document the size of the tube, the suctioning tube that I used, which was an 8 French. And I would notify the provider on how he handled it. Also, prior to this, I would have put on proper PPE, including goggles, a mask, and gown. And that's it.